afternoon, everyone, and welcome to today's webinar presentation on centering Indigenous ways on learning mainstream approaches in substance use. My name is Pam Lees, and I'm a public health physician at Public Health Ontario, and I have the pleasure of moderating today's session. Before we begin with today's session, I'll mention a few housekeeping items. To enhance the presentation experience, the chat pod has been enabled. We encourage participants to submit content questions through the function at the bottom of the window. The moderator and speakers will address these questions during the discussion period. And if at any point during the session you experience technical issues, please email capacitybuilding@ohpp.ca. So we will begin with a land acknowledgement. We acknowledge the land we are meeting on as the traditional territory of many nations, including Mississaugas of the Credit, the Anishinaabe, the Chippewa, Haudenosaunee, and Wendat people, and is now the home to many diverse First Nations, Inuit, and Metis people. We're committed to reconciliation and building meaningful relationships through seeking mutually beneficial partnerships, taking the lead from Indigenous communities, and being accountable and transparent. We also recognize the expertise, strengths, and innovation and leadership of people who use drugs, which has been critical in developing, implementing programs and services in harm reduction and in responding to the overdose crisis. So I have the pleasure of introducing Daniel Coles and Adele Madigan. Today our session will be moderated by Daniel Coles, the advisor for Indigenous Strategy and Engagement with Public Health Ontario. Daniel is proudly Métis, having joined Public Health Ontario in January 2022, while serving as a fellow of McLaughlin College at York University. Daniel resides in the GTA within the lands of Haldimand Tract, having lived and worked coast to coast to coast, focused on educating and advising institutions, their partners and stakeholders on authentic and situated Indigenous engagement, indigenization, and decolonization with their respective realms for the mutual benefit and success of all. And we will also welcome knowledge keeper Adele and thank her for gifting us with her wisdom and teachings. And we want to share and offer our deep gratitude for not only today, but also the guidance she's provided in all of the work together. And we look forward to her presence. Welcome.
Thank you very much, Pam. And may we now invite Adele to provide some opening words of wisdom. Thank you.
Anin Bonjour, Adele Madigan in Disney Cause. My spirit name is Raven Woman. I come from the Turtle Clan. I'm a survivor of the day school and an intergenerational survivor of residential school. I come from the Batchewana First Nation of Ojibways, located on the shores of Lake Superior of Powhatan. Miigwech creator for this day. Miigwech for all the gifts of our earth. Miigwech for the sun that provides life-giving heat and energy for all of us. Miigwech for the plant life, for the water, for the soil and seeds, for rocks and air, and for all the animals. Miigwech for all these gifts, and we ask you to help us to be wise caretakers of this beautiful earth. Creator, help us today as we sit together to sit with open minds and kind hearts, and to listen and to speak with kindness and respect for all. Miigwech.
Thank you so much, Adele, for sharing and enabling us to both discuss and as well as reflect and learn together today. And so you can see here our agenda coming up today. And it is my honor to welcome and introduce our panelists today that will be discussing this very important topic and sharing their knowledge with us all. First, I would like to welcome Ashley Smoke, who is an Indigenous two-spirit parent who uses drugs. Ashley co-founded the Ontario Network of People Who Use Drugs and sits on the board as the secretary. They work for the Women and HIV/AIDS Initiative of Ontario as capacity building lead and does research and consulting work with dozens of organizations. They work locally to mobilize and empower the PWUD to take leadership roles in the systems that impact them and to advocate for improvements. Ashley works with the Dr. Peters AIDS Center on a national Indigenous harm reduction environmental scan and strategy, as well as a project about Indigenous women who use drugs, living with HIV, who experience GBV in rural and remote areas. Ashley is motivated to do this work because too many people have been lost and change is needed to prevent one more. Thank you, Ashley, for joining us today. I'm also very pleased to welcome Daryl Soulier-Lamb, who is the Mental Health and Addiction Systems Coordinator at Indigenous Primary Healthcare Council, IPHCC. Daryl is not Anishinaabe and a member of the Wikwemikong Unceded First Nation. She is a registered social worker and a Master of Social Work, Indigenous field of study from Wilfrid Laurier University. Daryl has years of frontline experience in case management, housing support, and advocacy for Indigenous community members. Welcome, Daryl. As well as we've seen to begin our talk today, we welcome Pam Leese, who is a public health physician with the Health Promotion, Chronic Disease, and Injury Prevention Department at PHO. She is also an assistant professor, cross-appointed with the Department of Family and Community Medicine at the Dalalana School of Public Health at the University of Toronto. Pam also practices part-time as a courtesy staff in the Substance Use Service at Women's College Hospital in Toronto. Her current research focuses on public health approaches to substance use. Thank you, Pam. I think we'll now move forward, and I'll welcome back Pam Leese to share some key findings from this recent rapid review. Thank you, Pam.
Thanks, Daniel. I just have 2 slides here just to give a little bit of context of how we came to this discussion. Initially was around partnering on a rapid review. So we wanted to focus on substance use services with and for Indigenous communities. The question for this rapid review is, what are the characteristics and approaches of substance use treatment and harm reduction services that have been co-designed and co-implemented with Indigenous communities? I'll just give some highlights of our key findings, and the document will be available shortly as we're finalizing it. But highlighted here in the 4 boxes are some of the main findings. Holistic health and going beyond Western medicine are central to substance use programs with and for Indigenous communities. So some of the examples of programs with a holistic approach included providing opportunities for learning and sharing, leading skills building and strengthening around Indigenous culture, and leveraging the power of physical traditional Indigenous spaces for healing, such as longhouse or sacred sites. One of our other key findings is that collaboration with Indigenous communities translates to services that are rooted in Indigenous ways and knowledge. So there was, a look at the meaning of that relationship together and how that impacts the services that are available. Indigeneity and culture are a source of strength and medicine was another key finding among the articles that we included. And there was a frequent emphasis on the diversity of Indigenous communities and calls for taking the lead from Indigenous communities themselves. So just on the next slide here, we wanted to have some discussion around what the collaboration process was like with Indigenous partners on this rapid review. And this was a source of learning for us in working on these topics together. So I'll talk a little bit about the planning stages and then during the write-up, and we'll be finalizing the knowledge product soon for sharing on the website. So during the planning stages, we had some grounding conversations on how to approach the initial screening of articles and the writing of the document itself to summarize the findings from the literature. We decided from these planning discussions to exclude any resources that did not have partnership with Indigenous communities. We wanted to look at the characteristics of those that included partnerships. And we also wanted to focus on an assets-based approach. And this was also key in selecting these articles with Indigenous partnership, in that there is a focus on strengths and assets rather than a deficit-based approach. During the write-up, we had a feedback process with partners from Indigenous-led groups and had a chance to discuss that important feedback. So some of the points of conversation here, we're recognizing that Indigenous communities already have many of the answers of what is needed in the community and how to shape services in a way that is most helpful for people. We also discussed naming rapid reviews as a Western tool, and that it's important to decolonize knowledge sharing. So even just looking at the method itself as something that is Westernized, and thinking deliberately about the process and what information is being shared when we do a rapid review. So we wanted to, especially in the discussion section, be able to center holistic health, and that's the aspects of emotional, mental, physical, and spiritual, and then discuss the move away from standardized models of care and building relationships first with communities in building services with and for Indigenous communities. We had a few additional unlearnings, we call them, and so in the methods section, being able to incorporate a description of the collaboration process, so how this discussion occurred and how all of the findings were discussed together was an important aspect to our team. And then we also had discussion of mainstream citation practices. So even our reference list, we needed to figure out a way to acknowledge the value and weight of narrative-based and oral knowledge from communities rather than the traditional Western academic practice of the citation of documents. And then the last unlearning we had together was talking about reviews and feedback shouldn't be limited to a document review, but that the discussions that we had on the basis of that information is also part of the discussion section, and being able to find ways to incorporate that dialogue was important as well. So it was a very important journey working on this rapid review together, and also leads to even more just important discussions like today's, and then with communities and doing this work together. So thanks so much for your attention on this portion, and looking forward to the rest of the discussion.
Thank you very much, Pam. And now we'd like to move on to the next presenter as well here, Ashley Smoke, who will share some thoughts around harm reduction and how organizations may proceed effectively with cultural safety. Ashley?
My name's Ashley Smoke. My spirit name is Gatherer of Medicines for the People. I can't speak my language because my family lost our culture through colonization and disenfranchisement, residential schools and day schools. I'm come from a place called Alderville First Nations, because of my grandfather's experience in day school and that of residential school for those before him, we had pride in, but separation from our culture, which made our family very dysfunctional and like unable to communicate and like problem solve and like come together and like really build relationships like once was the case in Indigenous communities. Um, it also came out in different ways like drug use, alcohol use, and mental health issues, like for my elders and like my extended family. And then I myself am the product of all these traumas experienced by my elders and ancestors. And I'm a prime example of like intergenerational trauma and what happens when those traumas that were experienced and addressed through that were experienced can't and aren't addressed through culture. Um, I've lived, I have lived experience with sex work, drug use, um, mental health, a whole host of different issues, criminalization, like human trafficking, like you name it, I've been through it. And I feel like a lot of the responses I have to certain situations are like the blood memories of my ancestors like coming through in that intergenerational trauma. And I feel like through my healing journey, the fact that I have access to more culture, I think it will be better for like my son. And because he like, I look at my elders and they have less intersections than me. If I look at my son, he already has quite a few, like he's 3 and he has autism and like a whole host of different issues. So I think if I do some healing and connect us to our culture, my hope is that he will have to go through a little bit less of what I had to go through. But it was through learning about these familial histories and working in harm reduction kind of at the same time that I started to become intrigued by Indigenous harm reduction. And even though it wasn't done much back then or even well, it was something that I craved as someone who used drugs. And I wish that I had access to, but harm reduction never like connected me to my culture and roots. So because of that lack of services and cultural safety that I experienced, I tried to find ways to help Indigenous folks in my community that served them and connected them to even like a piece of their culture, even if it meant having a conversation about their family or their history, or like I would spend my own money to make sure that they had medicines or helping them out in whatever way I could that day, if I could. I would also use the like language that they recognized and terms that they used on the res to allow them to understand that I understood them, because like there's just that much better of a rapport when there's an Indigenous person or someone who understands a lot of those intricacies serving you. Like the rapport is just that much better and the care is just that much better. I would also share teachings through stories that were like relatable to them, that involved street analogies. Like I had to be really creative, especially with these 2 young men in particular. And but it allowed me to build a trusting relationship and like gain a reputation of trust and acceptance in the communities that I served. Um, I helped them out in different ways, like showing them how to access friendship centers and what ceremonies and programmings were offered, and like kind of like the vibes there so that people wouldn't feel uncomfortable, or if they wouldn't feel comfortable, I wouldn't kind of refer them there. Like I had to really gauge the person and the experience they would have before I would do referrals. Um, I didn't have many tools, but I used all the tools that I did have. I began collecting sage and medicine so I could smudge folks on outreach. To this day, I always bring medicines to events, like in case anyone needs to smudge or in case I need to. Um, and also people who use drugs are often like banished from the medicine. So um, I find that if I bring medicines, those folks who don't have like access to it on a regular basis can have some of the exposure to it and kind of some of the feeling of that cultural traditional practice. I also began to gather a list of running ceremonies, cultural events in like the whole driving distance of our region because there was hardly anything in our region. And I would let folks know like which coffee shops or libraries would let folks who were displaced do like cultural arts-based activities. I found any ways to help my like Indigenous drug users, and I built real relationships and networks of service providers, and I have a head full of knowledge. And I think that systems navigation piece is a big piece. So yeah, and now I work at Dr. Peters Center and we're doing a 5-year environmental scan. We did sharing circles and interviews, and in each we had an elder present and a peer at all times. We made sure that there was comfort and anonymity. We offered connections to cultural resources in their region. We found everyone through word of mouth. So like one person would interview and then we referred another, they would refer one, and then so on and so on. So it really held true to our cultural norms and the way word travels in our communities. We also honored the aspect of storytelling in our data collection and made it more of a reciprocal partnership. Our communities are so different in a patriarchal world. We have to fit our matriarchal worldviews within it, and it's hard to manage, especially when like matriarchal might not always mean like female, but like that feminine caretaking energy. And it's like in our culture, there's 9 different genders, and with white supremacist societies and the gender binary, there's like a lot of confusion happening with our youth, and it's really needed to empower them to be confident and learn our culture and learn our teaching so that they can feel like their true authentic selves and start helping to heal the communities and healing themselves and supporting, and we need to support them to do that work. Also, the last piece I wanted to just talk about was this little picture here. I chose this picture because it symbolizes how Indigenous people who use drugs, I feel like this symbolizes our voice, and like the people inside the wolf are like who we want to be, and the wolf screaming to the moon, that's like our voices and how strong they can be and how they can bring that healing to our communities. And I just thought like that analogy and like the way that that picture makes me feel about people who use drugs and the power of our voices and the strength that we have. We just need to like come together and build the community's capacity and strength. And I think that we can do that through culture. So yeah. Over to Daryl.
Thanks, Ashley. So I did want to get started by just kind of reiterating. I know Daniel gave me a great introduction, but I just wanted to kind of reiterate that I am First Nations Ojibwe from Wikwemikong, and that what I'm going to be talking about today is kind of it's specific mainly to First Nations communities. So just being mindful that there are so many different cultures, Indigenous cultures in Canada and in North America, that what I'm going to talk about isn't, there's no pan-Indigenous way of learning, I guess is what I'm trying to say. So what we have on the screen here is called a medicine wheel. And the medicine wheel teachings are, again, First Nations teachings, and they do vary between different communities. So I even caught, Ashley said that they are a matriarchal society. So as an Anishinaabe person, we are patriarchal. So even just between the two Indigenous people on the call right now, we know that, again, there's differing cultures and beliefs and teachings that we all have. So we don't want to lump Indigenous peoples together. So this medicine wheel is a tool used by many First Nations as a way to understand the world around us. The wheel includes teachings about the 4 directions, the seasons, the stages of life, races of people, and on and on. And we could go on about these teachings probably for years. There's so many meanings to each of these quadrants, but today I'm going to be focusing on the main quadrants of the mind, body, the spirit, and the emotion. Actually, I wanted to start by the circle teaching. So the circle teaches us, first of all, that we're all connected. Our connection is continuous and that there are no separations in between. We're always connected with those who came before, our ancestors, and we will always be connected to those who come after us for the next generation. So that's kind of what the circle represents. It also represents that we're all equal. And in the circle of life, no one is greater than another and no one is lesser than another. We all come from the side of the creator, and we will all return to the creator's side when our journey is complete. We're all different. We all bring different gifts, abilities, and life experiences to our relationships in the circle. Differences to be honored. We're taught to be open to those differences that we experience in others. And I wanted to talk about the meaning of holistic healing, at least again, the meaning to me and what holistic healing means to me, because it's different to other people. So when I talk about holistic healing, I'm referring to the word holistic with a W, as in the word whole. So the model of holistic health and well-being incorporates the emotions, emotional, mental, physical, and spiritual elements of well-being. And it's the belief that all elements must operate in harmony, meaning that we have to look at all, supporting all of the 4 quadrants of the mind, body, spirit, and emotion in order to support someone's whole health. So for example, the emotional health quadrants in the East includes doing things that make us happy or spending times with people we love, accessing therapy or other mental health supports as helpers, kind of, I guess, helping in a way that I think would be therapy. I think we're on the call with mainly social workers and mental health and addictions workers. And then in the mental quadrant, that would be supporting education, development, and growth. In the physical quadrant, having access to clean water, that could be having access to food, housing, exercise, proper sleep. And in the spiritual quadrant, for some Indigenous people, this could be accessing traditional teachings, healers, practicing spirituality. For others, it may be connecting with the land or praying to whatever God or person or thing you pray to if you do. For Indigenous service providers and healthcare organizations, we have identified culture as treatment, practicing our culture as a way to support all quadrants of the medicine wheel and to take care of ourselves. So this is just another version of that same medicine wheel with different teachings in the quadrants. Like I said, this 4 quadrants could be changed and used in so many different ways for so many different teachings. So again, for balance, harmony, and holistic health to be possible, people must be able to reclaim their sense of belonging, learning, interdependence, and generosity. Belonging, so the belonging quadrant, all members of the community belong and have a role and a valuable contribution to make. A sense of belonging is nourished by our first interactions with our mother, father, and immediate family. The word belong refers both to human interactions and relationships, as well as our relationship with the land, the water, and all of creation. Being connected to the land is important to gain a deeper sense of belonging. Children are the responsibility of their family, extended family, and communities. The learning quadrant, Indigenous knowledge is comprised of the complex technologies developed and sustained by Indigenous civilizations. Knowledge is often transferred orally through stories and teachings, symbols and metaphors, and passed on to the next generation. Information and knowledge through modeling, practice, and animation rather than written or documented in the same way Western communities do. Learning is viewed as a lifelong responsibility that people assume to understand the world around them and to emanate their personal abilities. The next quadrant is interdependence. The individual, family, and community are inseparable, and what affects one will affect the others. When working with Indigenous individuals, we have to take into account that they often will have their families and communities supporting them in any and all decisions that they may make. And lastly, generosity. Each person has a responsibility to their community and future generations when making decisions. Many people give back to community by sharing resources, stories, food, space, and so on. Sharing is integral to survival. When a community is strong, its individuals are strong as well. So I just kind of wanted to finish off by kind of reiterating all of the teachings that you've received today, that when doing any work with Indigenous peoples, it's important to ensure that the work is being led by these people. Again, we all have different cultures, beliefs, experiences. We're not just a one people, so you want to be including as many people as possible. Work should be collaborative and involve all levels of the community, including individuals, families, and community members. And Indigenous programs should be rooted in traditional teachings and culture, and should be guided by a holistic and trauma-informed model of healthcare and well-being. And that's it for me. So I'm going to pass it back over to Daniel. Thanks, everyone.
Thank you, Daryl, for sharing that wonderful knowledge. It's very informative. And I'd now like to welcome everyone to return as we move to the discussion portion. I'd also like to welcome questions. If anyone would like to put those in the chat pod, that would certainly be very pleased to discuss and answer among the panelists. But maybe just to kick it off here as we're beginning the discussion portion, I'll ask a very broad question, and all the panelists could answer it certainly from different viewpoints, be they Indigenous worldviews or even from a mainstream institutional worldview in some of what Pam and your team has uncovered through the rapid review as well as experience. And I'm kind of thinking on, where does the intersection lie with building meaningful relationships with communities, with Indigenous peoples, that again are authentic, that are meaningful, genuine, impactful, all those good words, but also that intersects with enabling our own self-determinations, our own resurgence and reclamation. And as we're doing that and learning on our pasts, understanding our presence, resurging into the future, how do we interact the self-determination within this meaningful engagement? Maybe I'll see if Pam is able to pull anything from the rapid review in terms of any responses around supporting Indigenous self-determination, be it First Nation, Métis, Inuit, and then I'll welcome Daryl, Ashley, Adele to provide any thoughts as well.
Thanks, Daniel. I guess my reflections would be based on the content that we looked at, and then also about some aspects of our process. So the self-determination was reflected in the Indigenous-led programs that we selected to look at, that it should be at least with engagement or leadership of the communities themselves, and not imposed by any other group or designed by any other group. I think from the process that we had sort of paralleled that as well, in terms of taking the lead from the group that we were working with, and looking at what was there in the literature, and what this does mean to practice in communities that are working on substance related programming. So I think within the process, is not for me to interpret the information, but to be able to take and work with others in a meaningful way, to take the lessons from people who are leaders in their own communities, and knowledge as well. So I guess those would be my two reflections.
Thank you very much, Pam. Daryl, Ashley, any thoughts?
Yeah, I'm just having a thought of a recent experience, even for my own self as an Indigenous woman. I was doing some outreach and engagement to other Indigenous communities, and we were doing, I was asking something on behalf of somebody else, but we were doing it in a way that it was rushed. And it wasn't personal, and it wasn't like one-on-one. I was kind of cold calling and messaging people. So lessons learned from that for me was to, I think we've kind of mentioned it, but not rushing work. You know, the Indigenous way isn't rushed, and I've received teachings on that. We have to take our time when we're doing these things, but also to make sure that when we are reaching out and asking people for their support or for their commitment to be really open and honest, and to kind of allow them to lead that work. So that's something that kind of an immediate thing that came to mind. But yeah, that's it.
Well, that's actually really important to note as well. So often, people that work within the institutional environment or mainstream have to move to meet certain deadlines and certain times. And even if it's positive work and trying to help, everyone has to understand that it moves at this pace of the Indigenous knowledge keepers, participants, people who are participating. That's so wonderful to note, and something that doesn't always get captured, unfortunately. And Ashley, you know, I just think back on when you were talking about the 9 different genders that you talk on from your different Indigenous worldview that you shared. And that alone also speaks in a way to self-determination. How do different Indigenous people view themselves? And within those different gender roles, even beyond our own indigeneity and different pieces therein. So that as well has to be honored within self-determination when we think on time, but we can also think on it's not just indigeneity, it's gender and all those other parts that make us human too, right?
Yeah, and I think that's where like the meaningful relationships come in, and just like seeing someone for who they are, meeting people where they're at. Like it's simple. It's just like treating people like people. But it also reminded me of a same situation that I had with the Dr. Peter Center, where we came together and we named something, the copper canoe, I think it was, or something. And we got a tongue lashing from an elder because we mixed 2 like sacred things together and without like consulting them, but it was out of like conversations that we had with them. But I guess we went ahead and made a decision. And then we got a whole teaching about like the importance of the canoe and the importance of meaningful relationships. And what that means is like you get your paddle, I get my paddle, and we paddle this canoe together, and we work together to do that. And that's what the meaningful relationships are all about. It's about like going to like the community and saying like, this is what I have to offer. Like, what do you have to offer, and how can we come together to make things better for everyone? So
Exactly. Now, that's such an important point as well around enabling reciprocation, you know, and that if I'm sharing, you're sharing as well. And how can we both share to mutually benefit each other and enable the land? And I'm just thinking back to the opening words that you shared there, Adele, as well, when we began today, and how this really does all connect back to the determinations of the land as well as all the living creatures within the land that enables us to live and to be. And you know, I was just wondering as well if there's any thoughts you may have, Adele, on different building relationships, but doing so authentically and respectfully.
I believe that one of the biggest things to remember is that trust and confidentiality is very important when people open up. I know that in the Western world, many of the times when people are sharing their information, certain things they might say are reportable. And it's very important to allow them to share their stories without feeling threatened about that type of the breach of confidentiality. I know that in the past, when I would speak with some of our people, and they would want to share about a past trauma, and I explained the confidentiality form to them about how I had a duty to report. One of the main issues is that they didn't want these things reported because sometimes it involved family members or whatever. I would encourage them to make the decisions on their own. And I would say, you don't have to tell me who the person is. You can just speak that of the trauma and not tell me who they are or their names or anything like that. So it still gave them, the control of their conversations. And many times I would find that later on throughout, they would make a decision on their own and in their own time to make a report, and I would stand beside them to do so. But it has to be on their own level. So confidentiality and trust building is really important, but it's also important to let them know directly about your personal duties and lawful duties as well, and give them that opportunity to still share, but yet to protect on the same law.
Thank you, Adele. No, that's extremely important to understand as well. This isn't just a series of transactions and interactions. This is a relationship. And with that, it takes trust, it takes time, it takes investment from all sides in order to see that seed of a relationship actually grow into something that can become engagement and hopefully even partnership that can help everyone. That's wonderful. I'm just looking to see if we have any questions that we've received in the chat pod. And I don't think so at this time, but maybe what I would invite is Daryl, Ashley, Adele, or Pam. Do you have any closing thoughts or remarks? Just maybe a final point that we just want to remind everyone on the webinar here today to remember as they move forth in their own roles.
Sure, I can go. So Adele kind of had me thinking, thank you for sharing, Adele. But for forever, people have been coming to Indigenous people and asking, or not even asking, taking, right? And then we've had people come and say they're here to help. We've had that, and we know that wasn't always the case, right? So even now, even today, there's a lot of mistrust. Indigenous communities and organizations and peoples of anyone saying they're here to help, because what really are you here for, right? So I think it is super important to build that engagement over time, build that trust, make safe spaces. But I think it's super important just to make sure that you're providing that time and that space and being honest and open. And again, working collaboratively with Indigenous people and organizations. Just take time and be honest. I think a lot of the times too, we feel like we are a checkbox. I mean, oftentimes I think a lot of Indigenous people and organizations are asked to do presentations or do this social media work around Orange Shirt Day. And then after Orange Shirt Day, it's quiet and these organizations aren't continuing on with their reconciliation efforts. It was a one-time thing. It was checkbox. We did that, and we can say that we did that, and that's it. As I kind of talked about in that medicine wheel teaching, learning is an ongoing thing forever and ever. It doesn't stop. It's not a one and done thing. You don't do one Indigenous cultural safety training and you're done learning. It's a continued thing. So, I mean, learn from what we've talked about today. I think me and Ashley both shared a mistake that we made in our engagement. You can learn from our mistakes, learn from your own mistakes, but just keep learning and making changes to make sure that you're doing better. So I think that's all I have to say. Thank you.
Thank you, Daryl. Ashley, would you like to say anything in conclusion today?
Yeah, I think like that ongoing learning is probably very key. But I think also like understanding the complexities of like what the history and what like the systems and structures have actually done, and like doing some of that learning, like, and not just in like the cultural trainings they do, but like make an effort on your own to like kind of learn some of these things. Even like just it's even valuable to learn like some teachings that you can relate to the work, that you can like introduce, and like even just having knowledge keepers that you can refer people to, like opening up networks, like engaging those like other service providers that can help support as well, and helping them to build their capacity to help Indigenous folks. I think that's important. But at the same time, I think it's about empowering us to take leadership and do this work. And like when we were talking about self-determination, for me, like I do this work for my self-determination, and because I I hate the way that the system is set up for us to fail. And no matter how hard we try, there are just blockages and like barriers and barriers and barriers. And no matter how many mountains we climb, there's still another one. And I'm so frustrated with it. So I had to do something. And I think I think if we empower more people with more opportunities and more leadership and actually pay people what they're worth, I think like we can really do good things. And yeah, we just need a lot of support and like funding, and like real funding, and not like checkbox funding.
Exactly. No, thank you, Ashley, for sharing that. It's right. It's not about being tokenistic. It's not about burdening Indigenous people. It's about partnering and sharing and enabling. That's
And
wonderful.
valuing.
The most important, I agree, valuing our ways of knowing as well. And with that point, I think it's wonderful if we could welcome Adele back to give us some closing thoughts and wisdom as we move forward now with reflection from today.
Before I do the closing, I do want to encourage everyone to research about what decolonization means. And that is very important for personal growth for each and every one of us inside, because we all have to make changes. We've all been colonized, and we've been educated in the colonized system, and we all have to know the power and prestige that each of us have, that we have to overlook at different points in times, and we learn new ways to look at it. So research that part of it. Creator, help us to put into practice what we have discussed and learned today. May the things we have learned today touch our hearts and minds. May we put those words and thoughts into our actions. Help us to make a difference for our people and for anyone who is mistreated and marginalized in any way or form. We need your help, Creator, as we go on and we do this wonderful work that we've been set out to do on the Creator's behalf, serving the most vulnerable people. Creator, help us to continue to be good medicine, for we are all good medicine. Each and every one of us that are here today, that sit together and have taken the time to come out and learn, Each and every one of you are good medicine, and you have wonderful hearts. Miigwech, 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 miigwech. Apo.
And thank you for your heart today, Adele, and sharing these words of wisdom, and as well as your very important encouragement for further reflection and research around decolonization. That is an absolutely fundamental thing that we all must engage on as we move forward. And I'd also like to thank Ashley, Daryl, and Pam for sharing your stories, voices, knowledge today. May it all enable us to move forward effectively. And I would also like to thank all of you for attending today as well and joining us within this PHO webinar. You can expect to receive a brief and anonymous survey following today's session. Please do try to complete this, as it does help to further improve our programming over time. Lastly, to access past presentations and view confirmed upcoming sessions, do visit the PHO website, head to Education and Events on the link there, and click on Presentations. Thank you all, and have a wonderful day ahead.